stood there in the pickup telling the people that assembled, and they were wonderful people. They had beautiful questions, and they kept asking us, uh, will it clean the water? Will it be safe to drink? So we answered all of their questions, and finally I asked them to bring me some of the water that they had, that they drink every day. And someone brought a bucket, and I looked at the water, and it was cloudy. I couldn't see through it. It was a little scary for me. And I said, "Is this what you drink?" And they said, "Yes, we drink that all the time. We don't like it, but that's all we have." So I poured the water into the filter that was sitting in the back of this pickup, and crystal clear, pure water came out. And it's obviously not all that simple, because there's a lot of things that go on with it, but we were able to show them that the water would be effectively filtered by this. And so they asked me, the next question was very insightful. They said, "Okay, if you leave that with us, how much will it cost to build a water filter if we do all the work?" And I was very clear. I said, "It's going to be about $25. And there's a man standing in the pickup with me, and I'm speaking in English, of course, and he was translating and speaking in Kannada. And I heard him say to all the people, he translated and he said, "It'll be about $10. And I said, "Wait a minute." And I pulled him back. I said, No, I said 25. You said 10. What's it going to be?" And he said, "It's going to be $10. Our group is going to pay the other 15. So their group, that was um, a very kind group of gentlemen, were going to help provide water for this small village. And I think I still know some people who live in that village. And I know somebody who's raised in that village too. And it's very, very nice place. It's a beautiful place, but a wonderful opportunity to help people. Anything else that I can do?
Thank you. That's
You're welcome.
a great to hear. So since I had the experience to work with you, then I wanted you to share that information with all the students. I'm sure that they will pretty much enjoy it. Well, thank you.
Yes.
So
And we will have many more opportunities for experiences, especially if you all join us. Just think what we could accomplish.
absolutely. So, well, thank you, Dr. David. And Shweta, if you can just please give me the little slide for me, that I think I'm going to try my best to give a little bit of information.
Alice?
Miss Benakati, can you please confirm whether the presentation is visible?
Say that again. I can't hear you. Okay, I'm going to go ahead and start whenever you are. So just go ahead and catch up with the slides. So that's okay if it's all right with you all. So, am I audible to everyone? Okay, so hello everyone. Good morning. My name is Anu Benikatti, and I am actually here in Dallas, Texas. I've been in US more than 35 years, and it's a wonderful experience being here, working with people, and also serving the community as well. Currently, I'm involved with the media as well as the community services. And this is a great privilege to work with the different diversity and melting pot that I live in this city of Dallas. So today, that it's a great opportunity for me to speak to you and share my experience. Today, I was asked to speak a little bit about my volunteer experience and getting involved with some of the health-related organizations that I serve for. My background is I have a master's in reproductive biology, and as well as I have done some clinical researches. So I'm not a medical professional, but as a matter of fact, like I have I have a great blessing to work with many, and then to serve that organization. I'm actually, privileged to know a lot of information about the bone marrow donation, and that is my presentation today. So, bone marrow donation awareness, combining health. Can you put the slide number 1? Combining health, humanity, and community action. So my presentation today to you that I'm going to share some information is actually focuses and emphasizes on sharing my personal experiences, as well as like what I have seen and then I helped, and as well as like what are the results of some of those situations through the creativity connecting health and humanity. So to serve the organization today, so to talk about the bone marrow donation, my connection to that topic is that currently I'm serving as a regional awareness ambassador for the state of Texas through the organization called PSP. PSP stands for the People Saving People. So this PSP organization was started by one of a wonderful gentleman, Mr. V.R. Cheney, and it started in 2010 in Dallas, Texas, USA. So when it is started, the ambition and the core value, and also to the reason, primary objective of this was to encourage and enable people to understand the importance of that, and also get them motivated to register for the bone marrow donation. To achieve that goal, what we want to do is to understand that the process and what it is, and then how we want to get involved. So if you just go and tell people that, okay, go ahead and just we want you to come and just be a part of the bone marrow donation, it scares the heck out of them, because they're like, okay, so I'll stay away and then I'm not going to come near you. So in order to do that, we created this specific way to convey the message to people without making them hesitate to do that. So a little bit of a bone marrow donation. A bone marrow, I'm sure that there are many experts in the crowd that I'm sure that it's all know. So I'm going to just briefly introduce how we are connected to this one and why we decided to do this. Bone marrow transplant is the life-saving procedure that, as we all know, for patients, suffering or the fighting the blood cancers, and such as nowadays it's actually increasing leukemia, lymphoma, or multiple myeloma, and the immune deficiency kind of a disorders, and of course there are many different type of cancers that we still have to find the solution and the medicine for. But the donors are they are hard to find, and so unlike many blood products, so the donations where a family member is the only option or the match, it is not the case anymore. And so that is the message that we are trying to convey a lot of people. So what exactly this bone marrow it's according to the American Cancer Society that we study a little deep into that one according to the researchers, they say bone marrow, it's a type of a stem cell. It's a soft spongy material found in the large bones. So it makes it more than like about 200 billion new blood cells. And also red blood cells, white blood cells, and also the platelets, in a whole 9 yards that I'm not going to go into the details, but this is what we are expecting the patients to understand a little bit about the bone marrow, what it is and how important it is and why do you need it. A bone marrow transplant also involves it's a very simple procedure, taking cells that are normally found in the bone marrow, and they are basically the stem cells, filtering those cells and then giving them back either then to the back to the donors, and also after giving it to the another person, the blood will be given back to the patient. And so the goal of bone marrow transplant is transfuse healthy bone marrow cells into a person after his or her own unhealthy bone marrow has been treated to kill the abnormal cells. I hope I said it right. So being trained to know this information, that we try to bring a little bit of awareness in all the community and to as a messenger. And this is what I'm going to say, one donor, 1 second chance. Because we might be thinking that, oh, I'm just one person, just me being involved may not make a big of a difference, but it does. Because even one person that if he can be a very special person, because it says like many people in today's world are currently battling with life threatening, like I mentioned, these conditions. And so you are the only person, you could be the cure to all of these disorders by donating your your bone marrow and the cells, and you are like a life-saving angel to that person. So in order to do that, what we need to know is a HLA matching. So like these terms might sound like so strange to a common man, because not everyone is a science student, not everyone has been through these difficulties, and then they don't even know what a donor or like what exactly needs to be done in these situations as well. So in order to know that, finding the right donor for a patient is like it's a very difficult, it's not that simple as we speak, because when we face that situation, we are always like a the panicking, like why me, like what did I do wrong, all those things go through your mind. So unless sometimes it's so difficult to say, but the reality is unless you are being in those shoes, that you are not very concerned or serious, but there is nothing wrong, but that's the reality and that's human nature, that happens. So both donors and recipients immediately in certain situations must match their HLA. And so these HLA are the genes which are in detail the human leukocyte antigens. So these genes specifically code for the proteins, or what we call as a markers found on the cells of our body. And these HLA is inherited, it's a genetical. So this ethnic background plays extremely highly important role in finding the match, because as a matter of fact, in America currently, it's a 1 in 20,000 match. Even if you match that, sometimes that not many things can go wrong, and it definitely is not a pretty situation for some patients. So next slide, please. Can I have the next slide? Okay, I'll just. So in order to deliver this message, so how much that can we do? So there are so many organizations. Be the Match is one of the biggest organization in America. Through that we volunteered, and we found out like how important it is to get involved and then contribute whatever that you can, because it takes a lot of commitment, it takes a lot of effort to understand the proper procedure or anything that what we want to do, what we don't want to do, do's and don'ts, the legalities. There are so many things involved in this one that we, as a main volunteer, as an ambassador, especially for me, it's highly required to understand everything. So this is not just a small one-day volunteering that you go and then do the job and come back, because understanding this procedure, and then especially the privacy called HIPAA here is extremely important to understand. Even though you are a volunteer. So like, how can we create this kind of awareness without breaking those rules, and also making people understand those, are by creating and different kind of things and to motivate them. So that is the reason we request a lot of volunteers. We motivate them, we ask them to come and volunteer for the organization. And not everyone has to go through this deep understanding of this one. Certain, like a volunteering requires you just come, motivate, like stay there for 2 hours, support them, and then just tell other volunteers and bring more people and say like, okay, so it's how important to understand this and get educated. So that is what we do, is volunteers can play a very crucial role, specifically in educating the public. So and not every public understands the importance of it, and they may have a tons of questions. And fortunately, we do have a great support for physicians who can really explain certain terms in a very proper way, and also to make them understand the deep meaning of some of the terminologies, medical terminologies that we, non-professionals that understand. So that is really a blessing. And the more than anything, that what I have noticed in my experience is there are some volunteers, they have already experienced it, and they have been through that, and they already know the how tough it is to be in that shoes. And then they come forward so many times, and they become mentors, and they say like, hey, this is not unknown to me, and I've been there, so who can, so they, most of the time, we actually assign them to connect directly with the patients with certain limitations as well. And so they go talk to them and click instantly and share their experience as well, and then help them to understand better and become they are like actually the voice of the community. So some of these stories, survival stories, are very motivational for many patients and as well as the community volunteers. I would like to share a very short story that happened in city right here in Dallas. So there was I'm not going to be able to, with the HIPAA, that I'm not going to be able to take the names of the either physician or the patient, but definitely this is something that I would love to share, like how it happened through the organization, that what we were helping. There was a 9-year-old boy who was suffering from leukemia, and everything was done, chemotherapy, everything, and it was really helpless. And then the physicians recommended that, hey, we want a bone marrow donation. So they were searching for almost 3 months, and we were advertising, we were just, putting our effort in finding. Sometimes, these things come like an angels and right next to you, and you don't notice it. We could not believe the boy found through our, spreading our messages through everywhere, is the donor was living just 3 blocks from his house. It was very amazing. And then you're not going to believe, and this donor also was an oncologist who signed up to, do the bone marrow donation registration just before she got into the med school. She said, I must do that. And the boy had one older brother, and her son also went to the same school as his brother. So there was a fate just came together, and then she saw the message, and and she said, like, thought about it, and since she was the most knowledgeable person about this field and how important it is, so she agreed to make the donation. And fortunately, it matched, And so they went through the procedure, and it was almost like a 3 months. Everything went extremely well. And then when we heard about that, and it became a very amazing news for the community. So this was one of the fantastic example that what we give even today, that like the treasury is right next door, but you don't know that, but all you have to do is just be a messenger, so that that message can be conveyed very well to the community, so that they also can be a part of this great work. So moving to the community service initiatives. The next slide is, so the I was talking about the type of services that are focused on bone marrow awareness. So how do we make the public or the community become aware of this, like why? So there are so many people say, okay, so we don't have time, I can't commit to the time. So and then but when they know the importance of this, because this is the most devastating situation when the families go through this, there is absolutely no way out. And it was very disturbing to even hear what's going to happen. You don't want to be part of it, but at the same time, if you want to be helping in any other way, when you say that I don't have time, it's very difficult for the other families. So whatever the time commits, a lot of volunteers, they do come and they just contribute. So how do we actually motivate these kind of situations? So we have been actively involved in various Indian organizations. Let me emphasize on this word, Indian organization. Like I mentioned, HLA. So this is like a very ethnicity based. There are millions of donor lists in that one, but not everyone can donate that marrow to everyone, because Indian can donate to Indian, African can donate to African, American can donate to African. I'm not saying that unrelated match, but it's rare. But the high possibility is definitely from the same HLA, because it's for the ethnicity based donations. So these Indian organizations, they exist. Like for example, I think we are involved in many organizations here in Dallas, and each, like as an Indian, you all know that we only speak like 26 official languages, and then they all have their one organization. And you can imagine like all the organizations that if we reach out, each organization can give us at least one or two volunteers, and that's how we grow to promote the registry. So that is one way of our reaching out to that. And it doesn't limit to only the city of Dallas, that we also spread our wings into the different cities like Chicago, New York, Washington DC, or Bay Area. So we are spread out throughout United States as well. So we also request them to come and be part of this and create their own small group, and to even share the organization. So, and also by creating few of the activities towards increasing the ethnic justice, we organize some of the music concerts. There are so many talented artists visit, or local artists do come. And this one is for the fundraising for, necessities for the supplies or any kind of like a donations that we do that. And increasing the awareness by participating in marathons. If you commit that one to one type of activity, that's a sports activity to bringing awareness of the health, then we can definitely do that as well. So now, and also I think, I'm not sure, I think maybe Dr. David knows that probably this is about a couple of years ago. So it was announced that the I think the youngest donor makes a big impact on the effectiveness of the donation. So they are focusing a lot on youth volunteers and the donors for the bone marrow donation. For that purpose, we are reaching out to many, the youth, that like where we can reach is the various universities, and then these opportunities to speak at several conferences, medical conferences and conventions, sports events, and of course the cultural celebrations like a holy events or any of the, like a Diwali celebration and things like that. So they give us a great opportunity to share the insight of like what we can do to do the these donations. So, and we also recently got connected with one of the largest Indian, the organization that actually does a blood stem donation. It's called Datri, and I'm sure that you are aware of it. So I also talked about the youth. I'm just going to give a little bit insight on that one. So building representation and support for bone marrow. So the organization PSP has a great number of youth volunteers, and they also go through this training program, and students are all from different universities and high school. So
Ma'am,
being trained youth.
ma'am,
Um,
ma'am, sorry to interrupt. If you
uh-huh.
could just wind up the presentation and
Yes,
if you
I
could.
will definitely do that. Sure, sure. Yes,
Sorry
I'm
to
going to do one quick
thank
thing, and then I will go ahead and finish it off. So, the important thing also I want to talk about is the debunking the myth, which is the representation. Like, so there are many misconceptions that are creating fear about the donation. And if you are like a painful, it is always, like it involves spine or something like a, the only family members can donate and myths like that. So which probably are not true. There are a lot of information available on the social media or even on the websites that actually can resolve these kind of a myths, so that you will be free of mind to go ahead and register to. And we also take an advantage of the social media to spread the word rapidly, to get everything some in, especially in urgent cases and things like that. So to wrap it up, as a my role as an ambassador, I'm very blessed to have played this role, that accepting this role, and this is my 6th year serving as an ambassador. And like I said, patients need donors who are definitely with the genetic match, and even with the registry of millions, we cannot find a match. So in order to do that, we definitely need an active participation and spread the word, whether it's in India, America, or any part of the globe. I think it's our responsibility to spread the word so that we can have a better options when a person go through this difficult portion of the disease. So, well, I would like to thank and appreciate the invitation, in participating as a speaker. And so I'd like to thank Dr. Mukta Karmadi and your fabulous team for giving us this opportunity to speak and share the insights. So contribution to volunteer community here in Dallas. It's actually my home away from home. So, well, thank you so much. Appreciate it.
yes, yes, ma'am.
Most
You,
welcome,
Melissa.
ma'am. Can start with the next session.
Great. Thank you so much. Yeah, this is great content, Anu. In fact, my baby brother went through the process of donating bone marrow just a few months ago. So I'm very proud that he could go through that and help a stranger have a second chance on life. So my name is Melissa, and I'm going to speak a little bit about the patient experience in U.S. healthcare. Anu knows that I've had quite a bit of experience in it. Sveta, if you want to bring up the presentation, you can. So the healthcare system in America is a bit of a mixed bag. I've had some of the best that the American system has had to offer. Near the end of COVID, early 2022, I found out that I was pregnant in my 40s with a little girl, and we were very excited for her But then we found health concerns, and I was able to get lots of prenatal testing, prenatal care. It was during a prenatal visit that they noticed her heart rate dropping, and my doctor left her own doctor appointment and delivered her within the hour. And so Junia came 8 weeks early, and she had a long stay in a NICU. You can go to the next slide, please. So she was in the NICU for 98 days with some of the best care that our system has to offer. I had a great job that had great healthcare coverage. Unfortunately, my daughter only lived those 98 days, but I do know that she had absolutely the best care, and we were gifted those 98 days that we probably wouldn't have had otherwise. But I lived at the hospital with her that whole time. Wonderful, wonderful team. And we were able to afford it. But I've also seen some of the less than ideal parts of the American healthcare system. You can go to the next slide, please. I spent some time in the insurance industry and getting to see behind the scenes of it a bit. I don't know what all information gets shared, but the insurance companies here have what we call political action committees, where they petition the government to be allowed to increase their costs even more than they have before, while providing less care. We also have a lot of clinics being purchased by venture capitalists. So we end up with insurance companies and investors deciding what care patients are allowed to have instead of the doctors. And it seems to me that's practicing medicine without a license, but they don't ask me. You can go to the next slide. And let's see. Yes. So all in all, too many people are building wealth between the patient and their health care. That's kind of the root of a lot of the problems with the American healthcare system. You can go to the next one, please. The big part of it is the insurance, because it is prohibitively expensive. The best tiers of insurance are tied to employment. And even then, a lot of employers will exploit the loopholes. They will divide their company into multiple smaller companies, because smaller companies aren't required to have insurance. So a lot of employers will exploit loopholes to get out of paying for providing insurance to the employees. And the government-backed insurance is very limited on which providers will accept it, limited in what it covers, and without enough free clinics or providers that will accept the government-backed insurance, the emergency department becomes about the only place for many people to receive care, because almost every other location requires you to pay in advance, and the emergency department does not. So that creates its own problems. And it gets it becomes such a financial decision that I have a friend who's chronically ill, who is wondering at what point is she too ill to even seek care anymore. And that is tragic. She should always be able to care, should always be accessible to some degree. And next slide, please. And even when you do access the healthcare, it becomes very complicated, and not everybody knows how to navigate the system. Many times you have to get permission from your insurance company before you get a procedure done. And not everyone knows that if they deny it, not everyone knows how to appeal that process. They don't all realize that you can ask for the qualifications of the person who denied your claim. I had a situation with, I went to the emergency room. I was there for 3 hours and it was $21,000. And so I had to have it run through my insurance. I had to request an itemized bill. I was able to apply for financial assistance, and that is the part that most people don't realize, is that we can apply for financial assistance, and that more people will qualify for that than we would anticipate. We actually qualified for quite a bit, even though we were making some pretty good money at the time. And then you can request. It's such a long, drawn out process. So I was able, after several months of many conversations with the hospital, I got my $21,000 bill down to a $3,000 bill, and then worked out a payment plan of $100 a month for 3 years. It's very complicated. And for those who haven't been inside the system, they don't necessarily know what it is, what steps that they need to take in that process. And part of the complicated billing, we were in the process of appealing a decision from our insurance company. They would not cover my husband's medication. And because of lack of that medication, my husband had a stroke on Easter. Thankfully, I recognized a lot of the symptoms. We got him to the emergency department very quickly, and he has made almost a full recovery, but it's a really big, traumatic, difficult event that didn't need to happen if our medicine would have just been affordable, would have just been accessible. And the last slide. We have, I know a lot of that sounds very bleak, and there are a lot of complications and a lot of things that need fixing in the American healthcare system. But I do want to end on talking about that we have more rights than we realize. You can go to the next slide, please. We have a lot more rights, and I'm grateful for those. When I spent a lot of time with the social workers and everybody else in the in Dallas Children's Hospital, I learned that you have the right to be informed and to give or withhold consent, including requesting or firing any member of your medical team. I learned that you don't have to have someone be on your medical team if you don't like them or trust them, or you have questions about how they're performing. There were a couple of people that I had removed from my daughter's care team, and but overall, our care teams were amazing. We have the right to receive information about our rights. Most of us aren't constantly thinking about what patients' rights we have. And when we become a patient, often it's from something we were not anticipating. And so there's a lot to learn and a very little time to learn it. We have the right to speak with a patient advocate or social worker who can talk us through the process, who can help us find what we need. We have a right to have visitors, and we can even ask about the staff to patient ratios. We have rights to a lot of information. So I'm very grateful for a lot of the experience, but also there are some parts of it that absolutely need changing, and I would love to see more collaboration with the medical teams at other.
Thank you very much for that. I hope I'm audible. I hope I'm audible to all of you.
Yeah, it was breaking
Yes.
up, but now you can. You are. Yes.
Yes, yes. Thank you very much to Ma'am Melissa, Dr. David, and Madam Anu. We have to unfortunately, end this session, and we don't have an opportunity. Our loss, because this was such a remarkable session, and on behalf of the audience and the entire organizing team, I would love, I would like to present my gratitude to each one of you, because of your, insights into volunteer participation, starting with Dr. David, that fascinating model of volunteer voyages, and all the work that has been done on donor awareness on a topic as sensitive as bone marrow donation by Madam Anu, and of course, the last presentation by Ma'am Melissa on affordability and accessibility. In fact, we have been discussing a lot about these issues since yesterday, and this session, I think, gave us some really valuable insights that we are going to incorporate in our work as well. Thank you very much.
Thank you.
Thank you.
Yes, we have our audience there. So this is gratitude from all of us. Thank you so much for joining.
Thank you.
Thank you.
Yes. Thank you.